Okay, good afternoon. This is the Module 7 presentation for medication noncompliance for Aspen University PAC 610 for the Week 7 module assessment. My name is Ruben Vazquez and I will be presenting medication noncompliance. Yes, I am in my son's room. I had some logistical issues trying to get this video uploaded when I was in Europe and Germany, but I couldn't. So anyway, medication noncompliance, the importance of this topic, one of the reasons why it's important, it's usually patients will tend to stop taking the medication once they start feeling better. They start feeling or they dislike the amount of side effects that they are experiencing taking that particular medication. Some of the research has surfaced indicates that about 6 out of 10 Americans are usually non-compliant with taking medication. Non-compliant medication, if not taken completely, or the course of treatment not taken completely, can negatively affect a specific treatment for what the patient is going through. Non-compliance requires a counselor or a physician to be able to talk with a client, to raise awareness, to explain the reasons why it's important to take the full course of treatment. Since the patient will be aware of what the treatment entails, it'll be easier for the patient to adhere to treatment. Case in point is whenever, for example, a patient has a cold, you're given an antibiotic. And usually when the symptoms start to go away or they start feeling better, they stop taking the medication thinking they've been cured. Whereas, you really have to be compliant with a specified medication, especially dealing with situations such as chronic pain and comparing that with the full course of treatment. Again, medication noncompliance, I determined that there was several studies that have been conducted in patients indicating that one reason patients stop deciding to take the medication is because they start feeling better. Medications need to be taken for the full course of an assigned prescribed treatment in order to help manage chronic illness and chronic conditions. Medication noncompliance is a behavior followed by patients under specified treatment where the medications either they directly fail or refuse to comply with the prescribed treatment. Mainly, non-compliant behavior, or NCB, is a term that is frequently used addressing a patient who fails to observe a prescribed course of medical treatment. A person who demonstrates non-compliance is said to exhibit non-compliant behavior, placing him at risk of healing from his specified illness. In addition, research like Kelsinger notes that NCB shows significant health risks associated with the U.S. population, since they determined that 6 out of 10 Americans are usually non-compliant with taking the full course of treatment, and most of them just stop. NCB also in their research determined that about 20% of patients who are non-compliant can have negative effects not completing the full course of treatment, either by side effects returning, or the symptoms returning, or simply having to switch medications because now the patient may not be responsive to the new course of treatment. One of the ways to prevent non-compliance is counseling the patient, making sure that you explain the course of treatment, all the side effects, what the course of treatment entails, the length of time that the treatment is going to involve, and why it's important not to terminate the medication, and to establish a good relationship between the physician and the patient in terms of the course of treatment. Non-compliant behavior must be addressed with the established collaboration with a physician, pharmaceutical provider, and the patient. All three of them should be working together to be able to understand how the prescription works, the length of time, the side effects, and the reason why this medication is being taken. There's many reasons why patients exhibit medication noncompliance, such as side effects, confusion for the need of the medication, and the cost, and the lack of the diminishing symptoms. For example, they start feeling better, they think they're cured, they stop taking the medication. Some medications, for example, blood pressure, other medications, cancer, once they start feeling better, they'll stop taking the medication, and it poses some serious risks. And some patients, some elderly patients, are taking other medications where the new medication has to be taken at a certain time in specific ways that they have to take certain medication, and they get confused of when they need to take it, or they mix it with other of their pills, so then the pill that they're actually taking is not being taken. So there's a lot of information with non-compliance that needs to be addressed for the patient so that they can follow the full course of treatment. The risks involved in discontinuing medication may not only adversely affect the patient's condition, but the discontinuance may pose severe risk of dangerous withdrawal, side effects, worsening symptoms, and complications in treatment. Also, the prescribed medication, by being compliant and adhering, it can significantly decrease the risk of ischemic events. An ischemic event is a transient attack similar to a stroke or mini stroke, which lasts for a few minutes as a result of non-compliant behavior. So that's important to be able to address with a patient. So especially when patients are taking several different types of medications, it's important to stay on the course of treatment. The research, Kelsinger 2003, explains that it is important to convey to the patient the importance of the medication, the adherence, since it is only under sustained adherence that they will ensure the full benefits of a specified treatment. Furthermore, medications for chronic illness can come from various side effects associated with the course of treatment, and patients may not want to continue experiencing those side effects. However, I believe that it's up to the counselor and the physician to be able to work with a patient to make sure that he will follow the course of treatment and fully understanding how this treatment is supposed to work. There is additional risk with NCB once the symptoms disappear. Usually if they stop the medication, in some cases the bacteria returns, or the cold returns, or simply the bacteria starts to cultivate in the body again, setting up the patient for either a relapse of the specified illness or possibly worsening conditions, or lengthening the length of time in which the patient is going to be under treatment. There are several strategies for addressing noncompliance with patients, and that is important for the physician to ensure that patient understands how their illness works, what are the side effects of the illness, and what are the damages associated with discontinuing the medication that they can create on their health. Also, some of the research that I found from Marks, Legrante, and Lori 2005, they determined that establishing a good relationship with a patient, addressing the challenges in the course of treatment, and simplifying the concepts, showing care and developing self-esteem and self-efficacy will minimize non-compliant behavior and failure in treatment. So you really want to try and make a relationship with your patient so that they understand exactly how the medication is supposed to be taken, how it interacts with other medications, and how to organize the medication so that they won't miss that particular treatment. The research also incorporates such strategies where you can have support for them, and empathizing of why it's important, how to address denial, such as they may believe that there's nothing wrong with them. However, you have to be able to convey that information. There may be cultural issues of why they may not want to take a specified medication. There may be side effects associated with personal behaviors, such as they drink alcohol, so the medication may require them not to drink alcohol, and they may not want to stop drinking alcohol. So those issues have to be addressed with the patient so that they don't fall prey to non-compliant behavior. The patient, physician, and the healthcare system must always work together to follow a predetermined relationship so that the patient can incorporate health literacy of how everything works, the awareness, the complexities of the treatment, and what side effects of the medication, and the time constraints of how long this is going to take so that the patient can complete the full course of treatment and be successful in his illness and the symptoms never reappear. With that said, I will close. Thank you very much and have a good evening.